Sometimes you can't believe them when they say, you've been banned from using estrogen forever. A myth that I hear very commonly in the office: if you've ever had a blood clot in your heart, lungs, or legs, you can never use menopause hormone therapy. And that is not based in science. Here's the key: you got to take it one step at a time, because not all clots are the same and not all estrogen is the same. Step one: what kind of clot was it? If someone had a provoked clot, this means that we know why it happened. Something like they had a big surgery, they went on a long flight, they broke their foot, and they were wearing a cast. This is a temporary risk factor that will then go away. Now, if someone had an unprovoked clot, which is where they had a blood clot that just came out of nowhere, that is a totally different conversation. Step two: what route of estrogen are you even talking about? Oral estrogen is going to go to your liver first, and this matters a lot for clotting risk. But transdermal estrogen, meaning goes through the skin, patch, gel, spray, ring, this has what we call first pass effect. And for some patients with a history of a provoked clot, transdermal estrogen might still be an option after individualized risk assessment, because we're realizing that transdermal estrogen doesn't really increase your risk over what your risk is at baseline. Step three: you need to individualize and not blanket ban. This is where we need to look at your full story: your clot details, your current risk factors, whether you're on anticoagulation, how bad are your symptoms, and what you've already tried. Sometimes hormones are totally still on the table, and sometimes they're not. But the answer should never be just a reflexive never without nuance. So if you've ever been told that you cannot use hormones because of a clot history, or you're just looking for a provider, comment guide below. And I'll send you my free guide on how to find a menopause clinician who's going to actually walk you through options and not just shut the door in your face.